and Human Services Committee, and Senator Jackson, Chairman Jackson, if you would lead us in prayer, please.
Let's bow our heads. Lord, we come this afternoon to say thank you. Thank you for the many blessings you've bestowed upon us. Lord, let this day, let this Tuesday, you give us guidance. You give us your grace. You give us your love to lead Georgia forward. Lord, bless every member of this committee here assembled. Bless every member in the audience. But more important, Lord, bless all your servants throughout this great state, Lord. Guide us, Lord, lead us. Let us make a decision that's in your favor, that will govern this state wisely, Lord. But, Lord, at the end of the day, give us your love and give us your blessings. These and other blessings we ask in your heavenly name. We all say, amen.
Amen. Amen. Thank you, Senator. Appreciate the love, and as the chaplain today said, peace, and certainly we need that this time of year and for the next few weeks. So thank you so much. We have, I want to say, do some shout outs today to Kaylin and Jocelyn and Lucy, and especially to our legal counsel, Betsy. Thank you so much. A lot has gone on behind the scenes, and we've had a lot of additions, subtractions, and so we got 5 bills, and we have a regulated industries meeting after this that starts at 3, and we'll certainly, hopefully we can be as efficient as the insurance committee was today. They were so efficient, gave us a little extra time to prepare, so thanks so much to them. And we're going with Senate Resolution 584. Senator Kim Jackson is out today, and that's going to be presented by Dr. Senator Michelle Al, and your mic is 10, and the floor is yours.
Thank you. This will be very quick. This resolution basically seeks to recognize May 4th as Hello? This resolution simply seeks to recognize May 4th as Maternal Mental Health Day.
I can't hear
10?
you.
10?
10 is not working. There it is. Okay, I'm sorry.
It's alive. Okay. May 4th is Maternal Mental Health Day, with our emphasis on increasing maternal health awareness, and also our emphasis on increasing mental health resources and awareness. This seems very fitting. So that's all this resolution seeks to do, which I think is a very good use of our attention. One thing I would like to offer as an amendment to this resolution, it's simply in line 1 where it says Maternal Mental Health Day in Georgia, to change that to say Maternal Mental Health Day at the Capitol, to make it structurally consistent, I think, with other resolutions.
That's my understanding, is that instead of Georgia, we're going to change that to Capitol. And if you're going to offer that as an amendment, that will read as the first line there, Maternal Mental Health Day at the Capitol instead of in Georgia. So that will, Senator Al is offering that as an amendment, and we have a second. All those in favor of this amendment, let me ask you to see if there's any discussion first. Just FYI, that's the reason it came to the committee rather than that. It was picked up on by Mine's Brighter Than I, so that's what we're doing. So all those in favor of the amendment, raise your hand. It is looks unanimous, so thank you. And then let's do the I will be happy to entertain a motion. Anybody offer a motion? Senator Halpern moves to pass. Senator Kennedy seconds that, and all those in favor, raise your hand. Again, unanimous. Thank you. All right, so that's Senate Resolution 584, and that's going to be LC 1240194 as amended. Did I do that right? As amended. Okay, thank you. So that's that. And then we have next is 539, Senator Hatchett. That is in your folder, and we are off. We have a substitute there, LC 339086S, and then we the Senate Research Office has the summary is in your folder also, and that's based off this substitute also. Okay, Senator Hatchett, if you want to, you can do from your right there is fine by me. So, and you're on number
11.
Number 11. Okay, floor is yours.
Thank you, Mr. Chairman. Today I present Senate Bill 539, which was brought to me by the Department of Public Health. An issue that they are facing around the state right now is individuals will go into health departments, HIV clinics, other public health facilities, and they will record and harass patients for a number of reasons. As of late, you can imagine with masks and vaccines. And so this has been an issue that was brought to our attention. One of the problems is right now it's not unlawful to record in these waiting rooms and in these clinics. And so when police were called, they didn't have any, I guess, legal authority to prevent them from doing that. What this bill does is it makes it unlawful without the patient's consent. So the patients that are in the waiting room at the county health facilities have to consent to being recorded or having photographs taken of them. I think this is a very important measure that goes to public health and safety, because we don't want people to be discouraged from going to a health clinic in fear that their identity or their personal information will be plastered all over the internet. And I'm happy to answer any questions.
And we certainly have the health department here to answer any questions if needed. From my understanding, people taking pictures of themselves in line, maybe getting a vaccine and capturing someone who's either in the waiting room or about to get treatment for whatever else is treated there, whether it's tuberculosis or HIV disease or whatever. And that's the privacy issue that is the concern. Is that
Yes, Mr.
is that
Chairman.
accurate?
That is accurate.
Okay. Anybody with any questions or concerns? I don't want to run through this too fast, and I don't think it's that complicated. It is, I guess, 5 lines there. Okay. If there are no questions, I'll be happy to entertain a motion. So moved by Senator Kennedy, seconded by Senator Kirkpatrick. Any further discussion? You got a quizzical mind there, Senator Dolezal. You're good. You got a question?
I was just going to comment. It relates to this code section, not this change, but it's currently legal in the state of Georgia to put a surveillance device on somebody without their knowledge. The proliferation of things like Apple tags and the very tile and things like that. Senator Jackson could legally, without my knowledge, track my whereabouts, and at some point in time I'm going to try to fix that, but not today.
I hear you. I appreciate that. And my understanding, and correct me if I'm wrong, it's the patients that may be getting themselves captured on camera, and that's the concern. Okay. All right. So, and which would violate HIPAA, the Health Information Portability Act. I think I left out an I in there. Health Information something. Okay. HIPPA. All right, gotcha. Thank you. The lawyer corrects me on that. I appreciate that. Thank you. Absolutely, they've certainly.
Who is the lawyer, Brass?
Okay.
Who is
All
the
right.
lawyer, Brass?
Yeah, Brass. Gotcha. All right. Okay, there we go. We're good. All right. So the posture we're in is motion seconded. Any further questions? If not, all those in favor, raise your hand. And that is unanimous. So thank you so much, Senator Hatchett. Okay. So. Next up is Senator Brass 573, and we do have a substitute there. And I'm going to elect not to take any testimony on this because we had a hearing relating to that last year before. That was rather exhaustive. I think it took up the whole meeting. But we'll certainly entertain questions with this. And the floor is yours there, Senator Brass. You know what? I'm sorry. Let me get the podium mic. Got it. Okay.
Thank you, Mr. Chairman. As you just stated, this has been debated and heard in this committee, and it's an issue that's really been around for a long time. And so I do want to acknowledge that the minority leader and her leadership, and she's put a lot of work and effort into this issue, and I wanted to kind of help out myself, so I jumped in and introduced a bill and was able to sit down with the Hospital Association and kind of work out some of their concerns, and that's really what you see in the draft you see before you. We just kind of took out a little bit of language here and there that could have caused some confusion, and really that's simply what it is.
Thank you. And we're off LC 33909-2S. And do we have any questions at all for Senator Brass? Did I call out the wrong number? That's 609. Okay. Okay, yeah, that's the right. LC 33909-2S. Any questions? Did I miss that? And you're on 12? Okay.
I know this was debated last year, and I was a no vote on this because I thought the bidding process was very poor. It wasn't done in a proper manner, and I think that's shown forth. I'm the wrong bill. We're not doing the marijuana.
No, we're doing surgical.
I'm sorry. I'm wrong. I couldn't find the S number on there. I was wrong. Okay, I'll deal with that later.
I could probably speak to that one too.
Well, you were involved in that one, so I apologize.
You know, I tell you what, Chairman, that we will hold that and keep that. We will consider that already done on the next bill.
I think he's talking about a different kind of surgical smoke.
Yes.
It doesn't mandate systems, does it? It just basically
No.
says you have to have a. Okay, then I understand this one.
Shall adopt policies.
We're saying you got to have a policy involving the system, and what we've done is we did take away the point of origin because it would limit it to a very small number of companies that can be involved, and so we've lifted that language so that now it's as long as the smoke is being evacuated, that is the number one goal. As y'all know, I have a vested interest in this with wife being a nurse. I just want to make sure that she stays healthy so that I can keep spending her money.
We appreciate that unselfishness on your part. Certainly. Do we have any questions? No questions? I'm sorry. Okay, 12.
Thank you. I'd like to ask the Senator, what did you mean by your last comment? You said some companies.
So
That meant you were referring changing the bill?
So the point of origin is meaning that there's, right where the tool touches the skin or whatever is cauterizing, there's a small amount of companies that have the equipment that actually can evacuate the smoke at that point of origin. So what we've done, there are other companies that can evacuate the smoke, but not necessarily at the point of origin. And so we've lifted that language and just really to kind of open up the market a little bit more to where, if you're some of these rural hospitals may not be able to afford the point of origin equipment, but yet they still want to be able to do something. We didn't want to mandate that they go spend money they don't have. So really we're just trying to open it up to where there's more companies that can provide this service.
The gold standard, if I could ask one question, is to evacuate that smoke at the point.
That is, that is the gold standard. There's no question about that. Well, there may be some question on that, but I'm not going to argue that point. But my goal, number one goal, is to get that smoke away from our nurses, doctors, and patients. And so I didn't want that one little hang up to hold up this bill that I feel like is overdue.
I have another question here.
I just wanted to make a comment. Since I spent most of my life in an operating room, like Senator Au over here, and I think the point is we care about the safety of the personnel in the operating room. However, this technology is evolving every day, and there are different ways to skin this cat. So it might be point of origin, it might be a machine in the corner of the room, or it might be a ventilation system of the room as a whole. And who knows what it'll be 4 or 5 years from now. So I think that was hopefully what you were intending to do, is to make it a little more flexible.
Yes, ma'am.
All right, Senator Al.
And then just one more thing that I want to point out that I appreciate about this iteration of the bill is it does allow flexibility based on different types of surgical procedures. So just again, to my colleague Senator Kirkpatrick, who did hand surgery, that type of surgery is very different from something like an abdominal surgery. So just allow the flexibility that different types of procedures might not require the same degree of smoke evacuation. That I appreciate that change.
Thank you, Doctor.
All right, Dr. Dolezal.
Thank you, Mr. Chairman. I have a question for the author, or perhaps one of the other doctors, if this doctor cannot answer the question. It's twofold, really. One, what have other states done in this regard?
That I don't know.
Okay. And then secondly, could it be a policy that we're going to implement something 5 years out, 10 years out? In other words, if this passes, are we going to see installations within a certain amount of time within every hospital or ambulatory surgical center? Or what's your expectation as to what would happen, and then what's approximately, as far as you understand, the underlying cost?
Well, I mean, my hope is that hospitals see that this bill is coming forward, and if they don't have a policy, that they would go ahead and start that process now, because as soon as the governor signs this bill, it would become law. So I would hope that they would go up. Any that do not have current policies in place would go ahead and begin that process, because they've got a few months to get it in place. But the ultimate goal is, I think I just said it, but is by the time the governor signs this, to have everyone with a policy in place to remove and evacuate the smoke.
Great. Follow-up, if it's okay, Mr. Chairman, either to you or to one of the real doctors on the committee. If we were to ballpark, and maybe even the minority leader knows this from the work she's done on this, how many hospitals already have something in place? Not that I'm saying that would preclude me from supporting this bill. I'm just curious, are hospitals being proactive in addressing this risk already?
Well, I can, as a fake doctor, I can acknowledge a lot of your newer hospitals already have some sort of, they've already got the systems in place. It's some of your older hospitals that would need to be retrofitted. So I don't have numbers on that, and someone else may be able to help me with that. I know we got Pat Thornton here that could probably have some stats on that, but.
Anybody else? Any other questions? Senator Jackson.
Yes, sir. And this question is to you, Mr. Chairman. Would a podiatrist's office or surgeon office be considered an ambulatory center?
Whatever the definition of ambulatory surgery center is, I think the podiatry do fall under that, if I remember correctly.
And
that's a single
oral surgeons
specialty.
also, correct?
Oral surgeon.
Yes.
I'm not going to be an expert on that,
Okay.
but probably not.
There's a lot of dust that. Anyway, all right, Mr. Chairman.
Okay. Any other questions? All right, I'll entertain a motion. Motion moves to pass from Senator Kirkpatrick. Got a second from Senator Au. Any further discussion? All those in.
I really want to give a full-throated thank you to the minority leader.
Yes.
Who has had a study committee on this topic. Most of us were totally unaware of this as a health issue. Brought out the fact that particularly women losing their pregnancy that were working in the operating room and exposed to surgical smoke, and it happened in such numbers that things actually were being done about it. But I just want to lift up the work that you did, Senator Butler, along with the advocates who have been pushing for forward motion on this bill for years. I think it's a positive step that we're at last moving forward.
Thank you, Senator Orrick. Thank you, Senator Butler, leader. Any further discussion? All those in favor, raise your hand. All right, again, that's unanimous. Okay, thank you.
Thank you, Mr. Chairman.
Yes, sir, thank you. All right, we're coming to two bills that were assigned to committee this morning. Senate Bill 609 will be first, and we'll have Senate Bill 610. And 609 is Senator Mullis, and he's at the podium, and then we're going to have his testimony augmented by Senator Burke. So we have a substitute to Senate Bill 609, which is LC 33909S. And the floor is yours, Mr. Chairman.
Thank you, Mr. Chairman and committee members. I'm proud to be here today. And my doctorate emblem is in my office. I could bring it out if that helped me here. I am an honorary doctor, of course, in many fields. But, and let me thank you for the committee's work on this committee substitute that I really don't know what does, but I'm just glad to be here. I'm going to give some underlining stuff, the summary. This provides that the Georgia Access to Medical Cannabis Commission is subject to Georgia procurement laws. It also amends the information to provide that the Medical Cannabis Commission Oversight Committee has some required features. The amendments it amends the number of Class 1 to Class 2 production license that can be issued by the Georgia Medical Cannabis Commission Oversight Committee, or Cannabis Commission. It also amends the dates for the study of the minority participation. Also provides that the Georgia Medical Cannabis Commission is subject to open records laws, and it amends the Georgia Medical Cannabis Commission license and licensure process. As you know, they went through this process last year. It didn't come out well for a lot of people. I don't even believe that the groups that I was working for, they even read our application. So I look forward to the, I can answer any tough questions, but Senator Burke has all the easy questions that he can go over. Senator Burke, if you will, please.
Senator Burke is on 3. Thank you.
Thank you, Mr. Chairman, and the Powerful Rules Chairman for your work here. The substitute does a couple things in an effort to kind of move the ball forward for the folks in Georgia that are anxious for this to be done. One, it sets a deadline for the commission to handle their that appeals process to July 1st. The second thing it does increase the transparency of the process. Other than trade secrets or proprietary information, all the rest of the process is subject to open records. The other thing it does is it rescores everybody else. So if you were already awarded a license, then that process is being handled by the appeals process that's already underway. So all the rest of the license applications will just be rescored with this new transparent process. And we contemplate that any new additional licenses would only occur if there were 50,000 patients added to the registry of people that qualify. And at that point, you would allow the commission to provide 2 more licenses, one in the Class 1 and one in the Class 2. So that's the overview of the bill. Again, this is an attempt to kind of move the ball forward, but not go beyond what this committee passed in the past to try to make this process safe and not turn it into California, to basically put it in perspective, so.
All right. I'm going to recognize Chairman Huffstetler.
Thank you. I'm obviously moving too fast for a grandfather earlier because I got my bills out of order here. But, and like I said, I voted against this last year because of the competitive bidding process, not because of, I give Maternal to patients routinely for nausea pre-surgery. It's not against the drug itself, but this bidding process. So what are we doing about that bidding process that I think was a very flawed procedure? I'm not sure if you're saying you're rebidding or rescoring, or so you're starting from scratch, or?
Well, we're not starting from scratch for the 6 that have already been awarded. We think that ship
So
has sailed.
So the 6 that got through a bidding process that we probably would all agree was a very flawed process still keep their license, is what you're saying?
No, only if they pass the appeals process that is already underway. It's just.
Will all that
So let him finish. So we got the appeals process that the 6th, and we just put a date on that. So July 1, and then the others are going to be reevaluated, or required to be reevaluated in this legislation.
So I still don't understand, will they have a leg up? I mean, if they go through the appeals process, are they clear, or are the others at an equal footing on getting these 6 licenses?
It would not be equal footing in that they did award and the appeals process is halfway through, and I think, again, it's just my opinion that it wouldn't be proper to go back and start this whole process over. I mean, if you want to, I guess, kill the registry and the fact that we would be doing this in Georgia, that would probably be a good way to do that. But again, in my mind, you know, the people that are waiting on these products have waited long enough, and we've got to make a decision and make a call. I don't think there is a perfect way to do this. I'd be the first to admit that, but I think this is the best of probably 2 or 3 bad choices.
Will all the records from this past process, is that being brought forth now, or?
Well, the transparency.
Does that bring back all the old information?
Well, all of the old information will be available because they're going to rescore it, and that process is transparent.
Okay.
Who's first? All right. That's like witness number 2.
So, Mr. Chairman, let's say these 6 that got them score on the 10th percentile and the other 16 that apply are on the 90th percentile. You're going to leave those 6?
Well, again, the appeals process is going to go into play. So
they wouldn't appeal if they got one.
No. I mean, the appeals process that is currently started is going to finish. We're just telling them they have to finish by July 1. They can't drag this out to the end of the year. So we're not changing that appeals process that they've already.
So what's the potential outcome in the appeals process? If somebody wins their appeal, does that throw open the bidding again?
I'm not familiar with the internal regulations of the commission. That's a good question. I can't answer that. But
okay.
Senator Kennedy.
Thank you, Mr. Chairman. Chairman Brooke, I think I've got some questions along the lines of Senator Cowsert, Chairman Cowsert, which is, so if the 6 that won, if one of their appeals, if someone else has appealed the award of their license, do you know how that appeal process plays out? And where I'm headed with this is it possible that that appellant or appellee, either one, winds up under these proposed regs? And I'll tell you where I'm headed with this is the concern that is it possible that someone who has some vested rights under the previous statute that we passed, are we changing the rules of the game, if you will? And if so, I think that may present some legal issues, that they may have some rights under contract that could be recognized.
I mean, again, I'm not a lawyer and certainly not an expert in the procurement process, so I don't want to get too far off on a limb. But in my mind, the commission has its work to do that was already determined by the bill we passed in the past. You know, they have a process, whether it's in statute or in their appeals process. So that will go on, and those outcomes will be what they are. Every other state, from my understanding from talking to folks in this industry, every other state that's done this, the final determination is made in court. I mean, they're always, you know, litigated. And so that, I don't know that that's going to change. You know, whatever we do, that's going to be the ultimate outcome, because that's what has happened in every other state. So in my mind, we are trying to develop a process to make this happen quicker. I mean, that is the sole reason for what we're trying to do, is to get to that point sooner rather than later.
Okay. So it's not changing the protocols or the standards for issuing licenses. It's just fast tracking the process.
That's right. That's the intent.
Okay. Thank you. Thank you, Mr. Chairman.
Uh-huh. Any other questions?
One other question, if
Okay.
I could. I'm number 12 here. So there's, what is it, if I remember, 16 or something that are protesting, or was that the right number?
I think so.
Does this change that in any way? I mean, will they still be going through the court system for the next?
Again, the
5 to 7
bill that
years?
we have, the substitute does not direct the commission to change anything. It says, do your work, but you need to do it by July 1st.
Okay. So their appeals will continue as they are right now. Is that what I'm?
Well, I mean, if you say as they are right now, that might mean that those appeals could last for 3 years. We're saying, commission, you got to do your work and you got to get it done.
Okay.
Senator Jackson.
Yes, sir. Thank you, Mr. Chairman. Chairman Burke, you mentioned about minority participation. Can you elaborate a little bit more about it?
I didn't mention that.
I did. I think that stays as is. We just want to monitor and make sure that, I think the application that I was involved in, they never once checked that, and we were well above the percentage we needed.
Okay.
And that should be part of it.
Can you elaborate? Of the 5 licensed, were any of them a majority minority company? Of the 6 licensed, were any of them?
I think some of them were not.
I think all of them were not, Mr.
Okay.
Chairman.
And look, I could say several words, but I will try to be professional. It was not done well at all. My recommendation would be throw those away and start all over again, but I know legally you can't do that. But that's what I would recommend. I know you can't do it. I'm just talking mountain talk.
Of the
Okay?
6, one of them?
All right. Any other questions here? Senator Cowser.
Senator Burke, as I read these additional licenses, it's an infinite number. You give one new Class 1 and one new Class 2 for every increase of 50,000 patients. So there's 21,000 people on there now. They're going to break 50 in a couple of years, but then, you know, we got 11 million people. Theoretically, if we expand the number of illnesses that can be helped by these low THC oil things, you might end up having 1 million people on the registry and 20 licenses. So this doesn't, I mean, the original bill didn't ask but for 8 or 10, and the Senate came back at 4, and then the conference committee was at 6. You're now blowing the cap off to where there could be any number of licenses depending on how many.
I think your point is, I guess, theoretically true, but it is based on the fact that we've put very careful restrictions on those conditions, and they have to be approved, I think, by the composite board, if I remember.
It was shifted to the Public Health Department.
To the Public Health. But anyway, there are medical professionals making those calls on who is covered, and in my mind, the amount of people that get the licensing is the critical piece. In other words, if you've got 1 million people, is there an advantage to those 1 million people being served by 6, or is there an advantage to be served by 40 companies? I mean, we're talking about treating individual patients, and I'm not sure that should be an artificial cap that then therefore, in my mind, makes it a monopoly and, only certain people can play. But again, these are challenging issues, and as you know even better than I, you know, we will be dealing with this issue in this committee, whether it's us or our the people that follow us for a long time, and we will have the option of making changes if we see that we need to.
Let me get Senator Halpern, and then we'll get you to follow up.
Thank you, Mr. Chairman. So I'm all for the licenses. I think this is great. I think we're going to find that we're going to have a lot of people who will qualify, and that this is something that we should be doing. My question is also around the maybe the awarding process or the bidding process. So we know that we said that we could have 6 licenses. That process happened. People liked it, didn't like it, but that was what it was. And that's all being appealed now for the folks who didn't receive a license. And we'll see what happens to the 6 who were. I question in this bill the part where the people who didn't get it, as new licenses open up and we do expand the number of licenses, that the folks who were in on the first bidding process are automatically the ones in the queue to get the next opening up. In any other contracting or procurement process, you open up your RFP again, and you get new people who may also come to the table, along with the folks who were already bidding the first time out. But that's the part of this bill that I'm questioning. How are we saying that? How many people applied the first time? 20?
Oh no.
80 something. Okay.
I think that was the second wave. I think it was couple of hundred.
Okay,
originally.
well, the six who got, or the 6 who are going to get. But the idea that based on a ranking system that the remaining people are queued up to be the automatic folks to get additional licenses is what I don't like in this bill, because I do think, again, in any other contracting and procurement process, you put out a new RFP when new availability opens up, and you allow for new entrants to come in and also apply and have the ability to be scored against whoever else applies.
Thank you.
And also, I think it was 70-something. I said 200. That was wrong.
I think it was 79.
Does Senator Mullins have anything to follow up with that?
Yeah, I just seem to have like 24 licenses, but I know that we won't get that today.
All right, and I mean, listen, if we need
think
an
it makes it more
amendment
competitive.
or another substitute, or Senator Burke has some thoughts.
The bill does specify that queue process is just 5 years, so that at that point there is I guess best you could say is a reboot of everything at that point.
Right.
But again, I'm from my standpoint, that's probably the least important piece of this. I mean, I understand people have their opinions about that, but I don't feel strongly either way, to be honest. So as far as that goes, that would be the will of the committee. But
okay. You know what? I said I was going to circle back to Chairman Calzert, and then we'll go with Senator Dolezal.
Well, I'm curious if anybody knows how many ounces of the oil is required per patient per year, and how many ounces of the oil per year one production licensee can make. It seems like your guys' thesis is that there are going to be more patients than there's enough production capacity. I don't think that's accurate. I don't know, do y'all know some data or something I don't know that indicates that 6 license holders would not be able to produce enough oil for 100,000 patients? Does anybody know that, or are we just making assumptions? Or
I don't know the answer, and again, I think the states that have done this, I think, have changed their law every year because they're trying to feel their way through the process. I really don't think there is a way to know exactly what that would
recreational. It's a blueprint, but anyways, that's. I just wondered if anybody has that data. We've got other states with people manufacturing. I'd love to see what is the production capability of.
Yeah, there's listen, I'm all on board. There is a lot of unknowns aspect related to this, and that's part of why we cut the number of diagnoses off, though it's not impossible to be done by the legislature. That's why we kicked it to the Public Health Department, because we're getting it for things that that didn't seem to make sense scientifically. Now, certainly you're correct. It has been thwarted by, federal law that has been addressed minimally, in my opinion. But it is a lot of this still be determined. But I have confidence in the science that eventually we will understand the dosage, frequency, percentages, and so forth. This is a little bit of a new territory on that. Senator Dolezal, you had a question?
Thank you, Mr. Chairman. I guess either Chairman Burke or Mullis, am I reading this correctly? I think this is what questions were asked. We will be precluding anybody for the next 5 years to reapply. So the new licenses will be fixed to only those who applied over the last 12 months. Is that correct?
That would be my interpretation as it's written.
Senator Kennedy.
Thank you, Mr. Chairman. Following up on Senator Dolezal's question, I guess either for the author or Dr. Burke, what's the policy reasons behind that part of the bill?
Well, I think the balance here, again, just, poor country doctor's opinion is, there are a lot of people who have spent the last 2 or 3 years in good faith going through this process, and that allows them to at least, kind of follow through to the process, has a reasonable amount of period for them to be successful. Obviously, we can't make that indefinite, but the folks that have gone to the trouble already and applied and they're appealing and so forth, I think they deserve some deference. Whether or not it's 5 years, 3 years, again, that's not part of the bill that I'm way more interested in getting the process going and having a reasonable growth of licenses as patients are determined that there's a need.
Thank you.
And Mr. Chairman, the process was a nightmare. It was terribly done, and there were many great applicants that weren't properly vetted or even read, in my opinion. So I like the bill the way it is in that regard. I think it was a terrible process. A lot of people were not treated properly on that and spent lots of money in there. Like one application I'm familiar with was 7,500 pages, and I just don't think it was vetted well at all.
I understand. Any further questions, discussion? I'll be happy to. I'm sorry, Senator Dolezal.
We're getting a little more to my sweet spot. We're going to talk business. This industry, as I with Curaleaf, Canopy, others that I know, is ripe with publicly traded companies that are doing lots of acquisitions. As I read this a couple different perhaps unintended consequences would be is you're immediately going to place to the highest bidder for those companies that are not in line an acquisition for the company that is next in line, because you're going to know what that score is. So there may be an unintended consequence there. And then additional to that is you may have somebody who would be the best provider through acquisition now, if there's been some consolidation, that could be the best provider would not even be able to apply under their existing entity name. So I would perhaps encourage us to think again just by maybe this particular section of the bill. I think maybe I'm hearing the most heartburn around that.
Also, Mr. Chairman, in this process, the hearing officer of those who were protesting the decision was the actual executive officer of the commission that made the decision in the first place. So that really wasn't, that's like the Fox Garden hen house. It wasn't a proper way to do it anyway. So anyway, you can tell I'm disgruntled.
I appreciate that.
I could say some good words too, but I won't.
Senator, all right.
Well, this is a Gordian knot here that we're trying to figure out how to cut. And in my mind, I keep going back to the population that needs access to the product, that we're trying to put in place a process to the end result of which is that there's vetted product available to those in medical need. And that, in my mind, weighs heavily toward figuring out how to move forward in a way that's not perfect, but in a way that gets product to patients that have been waiting now for years. So, I mean, all of this is weighing, various aspects, and it's not the perfect solution, but it is a pathway to get the manufacturing started.
Isn't that true?
Is
That's
that
true.
not true?
Is that not
Mr.
true?
Chair? I just
I got
urge
you.
us in our thinking.
I understand.
To
I
consider the patients, the plight of the patients. That's-
appreciate your thoughts. Thank you. All right. Senator Walker.
At the appropriate time, I'd like to make a motion, do pass.
All right. So we have a do pass. Do I have a second? I have a second from Senator Burke. Any further discussion? Discussion. 12. Gotcha.
I appreciate the sponsor bringing this here. I think if any one of those 16 goes to Fulton Court down here and files, this is going to be held up for 3 to 5 years. We've all said, even the sponsor of the bill, this was a terrible process. It was flawed. I mean, that's all on the record. We're all agreeing it's flawed. But yet we're saying we're still going to give an award to those first 6. I think the quickest path forward is to do an open, transparent, competitive bidding process, not what we did before, which was a major problem. And I think that's the quickest. I know I'm not trying to hold it up. I just think this isn't going to keep it from being held up, and so I can't vote for this bill as it is.
I understand. Any further discussion? Senator Cowser.
I agree with everything that Senator Huffstetler said. I mean, there are 4 or 5 glaring flaws in here and lots of unanswered questions. I feel like this is not a very deliberative process. We're flying this thing through here on our last day that bills can get out before hitting crossover. We're aware of at least 2 bills in the House that are being thoroughly vetted that I anticipate that something will come over if they can reach agreement. I'd love to see us, rather than rushing in, locking in a position with a lot of potential unintended consequences, that we understand it better, wait to vet theirs more thoroughly. So for those reasons, I couldn't support this either.
Anybody else? If not, let's go ahead and take a vote. I agree with you. It is not a perfect process. Committee process is not perfect, but to think that this is not going to change from here to the House and probably back and forth, I may disagree with that thought. So anyway, all those in favor, raise your hand. 1, 2, 3, 4, 6, 7, 8. There's 8. Is that right? All right, now all those against, like sign. 1, 2, 3, 4. It passes 8 to 5. Is that right? Okay, 8 to 5 passes. All right. So we have. Thank you, Chairman Mullis. We have one more bill. Senator Harrell, do you mind going to the podium too, please, like our Rules Chair? We're at Senate Bill 610, and let's see, there is no substitute on this one. Okay, all right. Or an amendment or something. This will be unchanged. All righty. Okay. All right. Let me get you got your podium mic is on. The floor is yours, Senator Harrell.
Thank you, Mr. Chairman. We worked a number of our issues out, hopefully all of our issues out before bringing this to committee so we could be neat and clean. This is Senate Bill 610, LC 339056. It is a fairly narrow and somewhat technical bill, and I'll be very concise because I know we're short on time, but I want to zoom out a little bit just to give you the context. In 1999, there was a court case, the Olmstead decision, that said that basically Georgia was out of compliance with the ADA, that we couldn't send people with intellectual and developmental disabilities just to a hospital where they would live out their lives, that they, under the ADA, deserve to be able to live and thrive in their communities. So we developed a number of different Medicaid waivers to provide those services. You might know this issue. Like, I was here 20 years ago serving in the House when the Olmstead decision was made, and there was immediately a waiting list. And you've probably seen that there's currently a waiting list of 7,000 people waiting for these Medicaid waivers, and that's something we need to do better at. But this bill is, like I said, very, very narrow. What I discovered when I really started looking into why do we still have this waiting list of 7,000 people is that we have a provider rate issue. We have people providing direct services to these people living with disabilities that are still making like $10 an hour, and it's hard to keep them in those jobs when they can go elsewhere and make a lot more money. So Georgia has actually appropriated money to fund some rate increases and has some applications out to CMS so that the federal government can approve those rate increases. But we haven't gotten the federal approval yet. And it's theorized that it might be because our provider rate studies are out of date. The last one that was done by the department was in 2015. So what this bill does, so that we don't get into a situation where people get waivers but go in to get the services and find there's nobody providing them, what we want to do is make sure that the department stays on top of these provider rate studies. So they're working on a comprehensive rate study right now. They think it's going to take about 1.5 years to finish. So what this bill says is that starting in 2024, that they conduct rate studies every 3 years thereafter, so that we never get so far behind that we can't get the approval for the rate increases.
Thank you, Senator Harrell. We much appreciate this legislation. Your thoughts. Do we have any questions? Anybody with questions on relating to this? I see none. Any appropriate time would be for a motion. Anybody for a motion? Senator Halpern for the motion, Senator Orrak for the second, and any further talk or discussion further? No discussion. Could be a first. Here we go. All those in favor, raise your hand. All those opposed, it's unanimous. Okay. So
thank you very
very
much.
much. Appreciate it. This will be so this was the last meeting, as I'm sure everybody could pick up on before, from our Senate rules relating to crossover. Just in case anybody's out there listening that didn't really appreciate that. Right now, so we are not having a meeting tomorrow. So, and if anything, no further action, a meeting is adjourned.